Hi, I'm Dr. Paul, and today I want to show you how to look at blood work in a different way. I run standard panels from LabCorp and Quest and some other labs as well to see what is the cause of your suffering. What is imbalance? What is nutritionally deficient? I'm a nutritionist, I'm a chiropractor, I'm a functional natural medicine doctor, and I want to be able to help you get to your health goals. So if you want to enjoy your grandkids and you want to alleviate suffering in your own body, suffering from things like cancer, diabetes, Alzheimer's, Parkinson's, those are the things, and arthritis, those are the things that you can do to start by looking at your blood works. And so if you see on the above picture here, there are different things that I ask in the LabCorp panel. And these are things that are very commonly done, but in the medical setting, they don't do all of these. For example, the ones that are highlighted here: uric acid, magnesium, albumin, globulin, alkaline phosphatase. These are commonly missed, and unless the doctor has a specific thing they want to look for, like alkaline phosphatase is for healing, LDH is for healing as well. It's also for cancer. Magnesium is overall, electrolyte that is necessary for a multitude of functions, but one in particular is dehydration. Uric acid, is for gout, but that's also a sign of inflammation. Here are the other ones that they don't do. Your liver is your go-to organ to help your body clean out and detoxify. Oftentimes they will do the ALT and AST here, but they won't do the GGT. Ferritin is a very common one that's not done, and if you have too much ferritin, that's going to cause extra inflammation in your body. We've seen people resolve from amazing things just by getting their ferritin down, and it's really actually a simple solution by giving blood. So we'd like to see ferritin levels. ESR and CRP right here are inflammatory markers, as well as creatine kinase, and vitamin D as well right here. So those are critical. Now the other ones here also that they don't do, there's a specialty test, is B-type natriuretic peptide. I can't even talk. And that's just an abbreviation, the B and P. That's for your heart. I had a patient here that they basically said that he was going to die, and so that's why I wanted to measure it. But most of his symptoms went away, and he's still vying on death's door, but all his symptoms are going down. I mean, he's gaining weight. He was losing weight about 5 pounds every month. He was not able to eat. He was not able to go to the bathroom. He had tremendous pain, and his heart is at 30% function, but most of his symptoms are going away because of the program that we put him on. Well, we checked his BNP, and his were skyrocketing. That means that because of his heart failure, he could die at any moment because of the BNP levels being high. So the older we get, this tends to go up, but there's a certain level that we don't want it at to help reduce the risk of a sudden death from heart attacks and strokes. The other one that I like to measure also sometimes is the osteocalcin. If you have any, particularly if you're a female or anybody that has a history of osteoporosis or osteopenia, which is thinning of the bones. So those are the common tests that I run. Now the other tests I run is also cancer profiles, hormone profiles, and those are important because these don't diagnose cancer, but they diagnose pathology. So do I want to know if I have pathological cancer chemicals in my body that are causing pathology? Yeah, I want to know. I want to be preventative, and I don't want to get cancer either. So doctors will use this routinely after they biopsy a tissue to diagnose them with cancer. That's the only way to diagnose cancer, is biopsy. But then they measure progress with these cancer markers to see if they're getting better with chemo or radiation. We've seen people go from stage 4 cancer to no cancer or remission of cancer just by following a natural protocol. We don't treat cancer. We just get their body healthy, so that when they go to their doctor, if they say, you know what, there's no cancer markers, we don't really need to put you on chemo, we don't need to put you on radiation. We just have them follow a health protocol that gets them healthy, and then it doesn't really matter what the name of the disease is. So this is what you do. You go to a LabCorp, and you'll see this form right here as well. that you're going to take. So you're going to see this form right here, and you're going to take that with you to LabCorp. This is the requisition form right here, and you'll take that to LabCorp. And then you'll probably get something that's on here too. If you're going to get a BNP, I'm going to put a sticker on the form and highlight the thing that you need to do. If you need, for example, if you need to get the BNP test, I will put that and attach it to this other form right here, and then the lab will know that you're going to get that test as well. So that's how I measure to see where your deficiencies are, so that you can live life the way you want to, that you don't have to suffer early with degenerative disease. I'm Dr. Paul. See you on the next visit.